If you've been to CHP lately, you've probably noticed that we're using a lot of new technology in the assessment and the treatment of our patients and our athletes. We've been getting a lot of questions about it, so I wanted to walk through today what this technology is, why we use them, and how they translate to better performance, fewer injuries, and faster recovery to your sport or activity. Today we're going to go over 4 key pieces of technology that come from the company Vald. They are the NordBord, the ForceFrame, the ForceDecks, and our Dynamos, which you will find at both our Bethesda and our McLean facility, and they have really helped us to step up our game so that you guys can all get better results for the things that matter most. First up is our NordBord. The NordBord is a system that allows us to test our hamstring strength and symmetry during a Nordic hamstring exercise. Using the NordBord, we can get objective numbers. How many newtons of force can you generate on your right hamstring versus your left, which helps us make decisions about whether you're ready to progress in your program, whether you're ready to progress to higher loads, and whether you're ready to be able to return to play, or you may have a higher or lower injury risk. And it just essentially allows us to create better decisions so that you're not going to be that person that has a hamstring strain, returns to play, and then suffers that same injury again. If you look at previous videos I've done on hamstring strains, you'll know that your hamstring strains predominantly when you're sprinting as it controls the tibia, right, the lower shin bone, from advancing really quickly forward as it has to when we're sprinting, right? As you are swinging your leg forward as you're sprinting, that shin is rapidly advancing forward. Your hamstrings have to put on the brakes, right, making sure almost essentially it doesn't swing too far, and that's oftentimes where we can strain it. And if we don't have equal measures on the NordBord here, show that you have an adequate level of strength and your ability to control those types of motions, then you are likely to re-injure it when you return to play. Or we can even injure it in rehab and training by advancing perhaps too quickly. And the NordBord helps keep us within check and give us objective data that we can use to be able to make decisions with the rest of our other clinical knowledge. Next up is our ForceFrames. ForceFrames are essentially a high-performance strength testing system that allows us to measure the isometric force that you can generate in various places throughout your body, upper body such as in the shoulders, and lower body throughout the hips, the knees, the ankles, and so on. And this gives us objective data in how you compare to maybe normative data of people who are similar to you or other athletes like you, and obviously allows us to test how you compare from one side to the other. Because if you have had an injury, we want to make sure, just like with the NordBord, that one side is equal to the other, and because perhaps it wasn't like that even before you had the injury, and that may have led to some of the issues that you're currently having. Or just since you've had the injury, that area has gotten a little bit weaker, and if we don't address that before we return, that increases your injury risk unnecessarily, with something we certainly can address. So this matters whether you're a high school athlete or an active adult. Again, this eliminates the guesswork and allows us to make objective decisions to ensure that you are as safe as possible to return to the activities that matter most to you. Third, we have our ForceDecks. Our ForceDecks are dual force plates that allow us to analyze how you move through the ground. Think jumps, landings, other dynamic tasks, and we can measure your force, your rate of force development, the asymmetries you may have in landing and takeoff, and patterns that could predispose you to injury. For example, one side absorbing more stress than the other, or maybe landing in a way that just puts more stress on your joints, for example. And for active adults and competitive athletes, this is gold, right? If you say, hey, I feel something funny when I jump, and we can turn that into a quantifiable data that tells us, hey, here maybe is your drop jump asymmetry. Here's how much force your left leg generates versus your right, how it compared to norms in your sport or to similar people to you. And that way we can address these numbers to address that discomfort that you are feeling. And then if you're a parent of a high school athlete, well, this gives us actual data that we can point to and say that, okay, here's what we're finding and here's what we can address to ensure that your child is as safe as possible when they return to play, so we reduce the risk of those re-injuries that we see and hear about so frequently. So we use this data for that types of information, those decision making. but also to safely advance the more higher level drills that we do in rehab, such as the plyometrics, like those jumps and things that you see us do on the turf, or the more sport specific drills, because we want to make sure we're being careful about how we advance those, which we have to, but make sure we're doing it in a very careful step-by-step way that the body is ready for, so we can make the best decisions throughout the rehab process as well. And when we see these numbers improving, that's a big deal. Last but certainly not least are our Dynamos. Our Dynamos are a smaller, more portable device that gives us strength measures and range of motion measures of various areas throughout your body. And we use this, just like with all our other devices, to be able to get truly accurate measures of what we're trying to see improve over time. So whether it's range of motion of a particular area that perhaps may be a little stiff or have its mobility limited, well, now we can objectively track this over time to ensure that you are making the progress that we want to be seeing. Same for the strength. Just like with our A-frames, it also helps us get a wide variety of strength measures that we want to be able to accomplish. Now, we don't use these technologies because they're high-tech and cool. We use them because it gives us objective data that, when combined with our clinical knowledge and clinical decision-making, helps us determine that you are getting the best results possible as quickly as possible so that you can return to what matters to you. At the end of the day, results are what's most important, and these technologies help us to get the best results possible for you when you come in to see us at Cohen Health Performance at either our Bethesda or our McLean facilities. If you are interested in getting help with an injury that you may be having and looking for maybe that secret that may help get you over the hump, come and talk to us. We would love to be able to help you.